Get down. Get down.
Good afternoon, everyone. We're just going to give a few more minutes for more people to join. We'll be with you shortly.
Get down.
Good afternoon, everyone. My name is Joe Costello. I'm a physical therapist and regional director here at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our webinars prior, as well as welcome those who are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We know that there are many bigger things going on right now, and we appreciate you taking the time out to learn with us today. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years, and we currently have 20 locations located all over the New York City metro area. We have continued to offer in-person care throughout the COVID-19 pandemic, and we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone within our clinics. For more detailed information on the safety measures we're taking, please visit our website at spearcenter.com. We've also launched Spear Live for those who are looking to stay in and receive care from the comfort of their own home. This gives you the opportunity to receive physical or occupational therapy treatment through our telehealth platform from any device. We're here for you in whichever way makes you feel most comfortable. If you're looking for individualized care, please reach out to us at your convenience and we'll get you set up with an appointment right away. We are here with you today because since the COVID-19 pandemic started, we began to notice a large influx of patients reaching out to us with complaints of hand and wrist pain due to increased use of technology and working from home. Our team of clinicians got together and agreed that given today's challenging circumstances, it would be a good idea to provide you all with some tips on how to both prevent and address any symptoms you may currently experiencing as a result of this new normal. We created today's talk specifically for you and are coming to you live from our own homes. We do not anticipate any technical issues today, but please be patient with us as we navigate working through this new technology. As a part of our session, we will be demonstrating some exercises, and we really look forward to you following along and participating. I promise you, this is not going to be your typical meeting, your typical Zoom meeting at that. We're going to have some fun. Please note that if you are experiencing any pain with any of the exercises we demonstrate for you today, please, please, please stop what you're doing and reach out to us directly so that we can help support you. So a little housekeeping. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. So if everyone can take their mouse and hover over at the bottom of your screen, you're going to see that Q&A option. This is where you will put in questions, and we will do our best to address as many questions as we can. For those of you who are watching through YouTube Live, we are monitoring the comment sections there as well, so please feel free to type your questions in. So here are the goals for today. Our goals are to help you identify your pain and what may be causing it. We also want to help you know what to do to alleviate your pain and prevent further pain from happening. And we also want to give you some tips and tricks on everyday household items you can use for some therapeutic exercise. So before we get started, I'd like to introduce you to our team of panelists. We're going to welcome everybody onto the screen now. First, we have Elaine Crerar. She's our occupational therapist at our West 57th Street location.
Hey guys, welcome.
We have Phaeleau Cunneen, who's a physical therapist and director of hand therapy at our West 44th Street location.
Hello, everybody.
And we have Ashley Rosick, who is a physical therapist and clinical director at our West 57th Street office. She's going to be helping us on the back end, answering any questions in that Q&A.
Hi everyone, welcome.
Okay, so Ashley and I are going to say goodbye for now, and without further ado, Elaine, I'm going to pass it off to you.
Awesome, thanks Joe. Hey everybody, thanks for coming. So Phaeleau and I are both hand therapists who work at Spear. And before we start, we're gonna take a brief poll. The first poll, we're gonna take two. So the first one is we wanna know how many of you are working from home. All right, so the poll should pop up. I know I've been working at home. Everyone's kind of been doing both. Maybe now with phase 2 going on, everyone's now going to the office. I don't know how happy everybody else is with that. So we'll give a little bit of time. This will be very interesting. All right, so the results are in. 67% of you are working from home. Very cool. All right, so our next poll we're going to do is how many of you currently have hand or wrist injuries? A lot of you may be working from home. Your injury may be from your work setup, or it could be from the quarantine activities that you've been doing. Maybe it's all the cooking that we've been doing as well. So this will all be good for us to know too. Oh man, Phaeleau, 82% of them have hand or wrist injuries.
I think this guy has an injury too.
All right, awesome guys. So this is all really good for us to know, and hopefully Phaeleau and I can give you some information that will help all of you.
Great. So, as the polls say, a lot of people are working at home, and with home comes challenges, new ergonomic setups and stuff. So today we're going to go over and review some common hand and wrist conditions that you may be experiencing at home. We want to show you how to differentiate one pain from the other. You know, a lot of it's going to be based on location. Is the pain here, or is the pain here, or is the pain here? And also what kind of pain? Is it a zinging, zapping pain? Is it a sharp pain? Is it a dull pain? And that'll help us differentiate and kind of narrow down what kind of condition you may have. And then we'll show you some easy things that you can try to do at home. We also advise definitely go to a doctor, but some things, these are some quick stop-gap kind of treatments that you can do, and also some exercises and tips.
Yeah.
Okay, back to you, Elaine.
Thanks. So currently some of you, well, a lot of you are working from home, and your home office setup may be completely different or maybe not ideal. Additionally, because we're working from home, I feel like everyone's kind of working all the time since our computers and phones are readily available. I know for me personally, I'm spending a ton of time on my phone, scrolling for new recipes to make, keeping up with just like the news or social media, or even trying to figure out what my travel plans are going to be when we can start traveling again. And I know it's been taking a lot of toll, like on my wrists and thumbs. How about you, Phaeleau? Has that been happening?
Yeah, so, you know, that's a great point. So a lot of us are, you know, kind of coming up with the challenge of working at home, and a lot of the office setups are on coffee tables or kitchen tables. They might be too high, they might be too low, and this throws your body off. Your shoulders will go up, your shoulders will be forward. Now, I don't know if any of you have seen it, but Kathleen and Rochelle, they're co-workers of ours, did a great webinar on ergonomics, proper ergonomic setup. And it's on YouTube, Spear PT, if you search for Spear PT. And it not only goes over the proper computer setup, the proper height of the computer screen, of the laptop, of the keyboard, it also goes over the proper setup of your body. So a lot of us, like right now, I'm on my coffee table, so I'm hunched over, which is bad for my back, my neck, and your shoulder. And if you're on this improper setup for 8 hours a day, you can experience neck, shoulder, hand, and wrist problems.
Yeah. All right, so I'm going to take it from here. I'm going to get started. So I'm going to talk to you guys about the first topic that we're going to talk about, and it's called, this fancy name called decurvains. So a lot of my patients have been complaining about pain by their thumb or maybe by their wrist, and it's called decurvains. And what this is, it's a tendonitis or an inflammation of the two tendons that control your thumb. So if you think that you have this, you've probably been experiencing pain with any kind of thumb movement, maybe opening a doorknob, opening a jar or water bottle may be difficult or painful, any kind of like gripping or pinching as well. And if you guys take a look at the slide, there's a red highlighted area, and it kind of shows you where you may be experiencing that pain. So the pain can be by your thumb, but can also radiate past your wrist a little bit, okay? So I want to demonstrate for you guys this test that we kind of use to kind of help us identify if it is decurvains, because there's a lot of things that can be going on your thumb side. So this test is called a Finkelstein's test. And what you're going to do, so hand in front of you, and you're going to put your thumb into your palm and wrap your fingers around your thumb. Okay, now this might be uncomfortable already. So what you're going to do is you're going to make like a hammering motion with your wrist. So you're going to go down towards your pinky. And if you're having any kind of pinching or pain there, then this can be a telltale sign that you have decurvains. Now, what should you do? So if you're having pain here, the first thing that you want to do is stop the movements that are aggravating it. So kind of like I was saying, that movement where you're going from like your thumb to your pinky, it's called deviation, radial ulnar deviation. So anything that involves that kind of movement, so opening a door, opening a really difficult jar. So what I would suggest is try opening the door a different way, maybe with your other hand. Ask somebody else to open the jar. I'm constantly always telling my husband to open things for me because they're really difficult. Or maybe using some sort of like silicone patch to kind of help you open it. Another thing you want to look at is positioning. So decurvains is also known as mommy thumb or daddy thumb. So any kind of new parents or grandparents, you constantly are picking up those kiddos. So you are going under their arms and you're doing that deviation movement, that kind of like bad feeling movement. So it's something that you want to stop. You may want to be picking them up a different way. Or our parents that are feeding their newborns, how are you holding them? What position is your thumb or your wrist? So when you are feeding them, maybe take a look in the mirror, see what your wrist or your thumb looks like, and maybe adjust that kind of posture. So what can we do? So I want to reference some splinting that can happen. So something in the office that what we can do is we can fabricate a custom splint for you, or even recommend an appropriate splint, because not all splints are appropriate. So a splint that we use typically is called a thumb spica splint, and it helps to immobilize your thumb, allowing the tendons to rest. So we want the tendons to rest so they're not aggravated anymore. You can also use tape, which you can see on the slide, that you can come in and we can kind of tape it for you or teach you how to do it. So the point is to really allow those tendons to rest, so those movements don't aggravate you anymore. Another thing that you want to look at is your mouse. So you're constantly on your mouse. A lot of my patients have been saying that their mouse movements have been bothering their thumb, or like that thumb side of the wrist. So using a vertical mouse actually can help decrease those symptoms. So Phaeleau actually has a vertical mouse at home, and maybe he can show us kind of what it looks like, how to use it, what are the benefits of it. Oh, there you go, Phaeleau, you have that mouse. Can you show everybody what it looks like? Oh, Phaeleau, I don't think I can hear you.
There we go.
There we go.
So as Elaine was talking about, it's this motion that kind of gets you in trouble with Quervains. And if you notice, what you're doing on your mouse is this motion. So what the vertical mouse does is it changes it to this motion. So it's a very simple kind of buy. So you're doing this motion, and it's a very nice stick shift kind of position. So you can go on Amazon and find there's multiple ones. This is an older model, it's a little bigger, but you can see it, and it's just a much easier motion. And it's something people are doing for 8-10 hours a day, this motion. So eliminating that motion is one of the keys to kind of helping with this condition.
Yeah, something else that can also help is icing it. So doing some sort of like ice massage on the area that's bothering you is also something that you can do to kind of get rid of that swelling and alleviate that pain. So thanks, Phaeleau, for showing us. I'll leave it off to you to talk to everybody about our next topic.
No problem. And, you know, and that's a great point, Elaine, about the ice massage. And I recently discovered that these kind of, you can take a Dixie cup or even the large kind of plastic, when you get the sauces on the side for to go, if you just fill that up, it kind of holds it and you can do a quick ice massage to yourself. So the next subject we're going to talk about is, first we did Quervain's pain over here. Now we're going to kind of cover some pain, numbness, and tingling here. And it's called carpal tunnel syndrome. And I think everyone's heard of it. But first I want to do a quick poll. Okay, so I'm just going to take a quick poll about, you know, testing your knowledge about carpal tunnel syndrome. We're just going to wait a little bit. People are going to vote in. And I put this poll up because through the years that I've been working, I've heard stories, you know, about what to do. Like people have carpal tunnel syndrome and it's like, oh yeah, my aunt's a nurse or nothing. I didn't want to say anything bad about nurses, but so we got the polls in. So it's yes, you should squeeze a ball, 47%, and no, you should not squeeze a ball, 53%. So pretty even, 50-50. And you know, the correct answer is yes, you should not squeeze a ball. And I'll kind of go over that. So I'm going to kind of go over the anatomy of the carpal tunnel a little bit. And again, I put that up because a lot of times people feel for hand therapy, let's squeeze a ball, you know, so the sponge ball always gets given out. So so this is the carpal tunnel, and they call it carpal because you can see the carpal bones kind of form the kind of the bottom or the roof, depending on which way the orientation is, of the kind of structure. And then you can see the blue part here, that what runs through the carpal tunnel are all your flexor tendons. So what are those? Those are all your gripping muscles. So if you're typing a lot or gripping, your flexors go through the tunnel. So that's why if you have carpal tunnel syndrome, if you think you have it, you shouldn't be squeezing a ball a lot because that will further inflame it. Carpal tunnel is basically an inflammatory condition. So what else goes through the tunnel is the median nerve. And again, you can see on this slide here, this is the median nerve distribution. So it's the thumb, index ring, and middle finger part of the ring finger, just half of it. But if you have numbness and tingling in your pinky, that's not carpal tunnel, that's a different nerve. All right, so the other thing I wanted to show you on this slide is the tunnel is most open when your hand is in this position. And a lot of times people with improper ergonomics, they're typing on a laptop, their hand is in this position and they're also typing. So I'm just gonna adjust my screen. So they're kind of in this position. So the tunnel is partly closed. And if you're typing all day, you can get some inflammation in there. Now, the weakest structure in the carpal tunnel is the median nerve. So that gets squished. So what we have to do is decrease the inflammation and kind of rest the hand in this position. So you can kind of come into the clinic and with a doctor's prescription have a custom thermoplastic wrist brace, but you can also kind of get a wrist brace like this. All right. And so I'm going to show you this slide in a second with the taping. But so the wrist brace, what it does is it keeps your wrist in an open position. So the wrist is in its most closed here and here, and it's open here. So a lot of times people have numbness and tingling when they get up in the morning, because like Elaine said to me, she sleeps like this, or people sleep like this. So you're closing the tunnel down. So you have an inflamed kind of region, and then you're closing it down. So some people sleep with these braces if they have carpal tunnel. So it's kind of an easy thing to do at home. If you think you have it, you can wear this brace. You can also use the wrist brace when you're typing. So if people get it when they're on their laptops all day, you can wear this because it kind of keeps it in the neutral position. Now, say you suspect you have it. There's a couple things you can do. As I said, this is the closed position. So what you can do is you can just, this is a test we do, okay, and you can just kind of close your wrist down and go for 60 seconds, all right? So you just set a timer, 60 seconds. And then you see if you get increased numbness and tingling in the median nerve distribution. That could be it. The nerve kind of runs along this area here, so you can also do a tapping. So you're kind of tapping on the distribution of the nerve. If you get that kind of zinging electrical feeling, that could be carpal tunnel. So again, I feel you should go to a doctor for a proper diagnosis, but an easy quick fix is using the wrist brace. Because it's inflammatory, I also recommend icing it, especially at the end of a long day, especially again with this heat and humidity out there. You've been typing all day, ice it and then put it in the wrist brace. Now this picture up here is a taping you can do. So I think people have seen the Olympics where people are taping their shoulders. So this kind of taping, what it does is it's a lifting of the fascia and a kind of alleviating some of the pressure of the median nerve distribution, which this kind of tape follows. What's nice about this is you can still function and move a little bit. And so I've done this with patients and they've responded really well. This stays on for 24 to 48 hours. You can shower with it. It's taped, so you can take it off whenever you want. But this kind of can help alleviate some of the pressure in the carpal tunnel. So wrist brace, icing, taping. There's also some stretches you can do as well. And because the flexors are very tight, one of the stretches is just stretching out like this. Now you notice what I'm doing is closing the tunnel down. So if you get numbness and tingling when you do this, don't do it that long. Usually I will recommend a stretch holding it for 30 seconds. Because it's carpal tunnel, I would want to hold off for a little bit. All right, so you can stretch your flexors, and if you're working on your keyboards a lot, I recommend doing it every hour. Another thing you can do is massage it. Kind of, I don't know if anyone's ever foam rolled their legs. That's another way of kind of stretching soft tissue. So this is a cat toy, and you can kind of just massage your forearm with it. What I like is you're not using your arm, which you might have carpal tunnel on the other side. And so you can massage the whole kind of median nerve distribution. So it's another way of kind of stretching if this causes you numbness and tingling. All right, we're going to go back over to Elaine now, and she's going to kind of go over another diagnosis.
Phil, that was really helpful. So I am always constantly sitting like this or like this, which is closing my channel. So I need to be sure that I do not do that, or maybe have a splint to kind of give me a reminder to not do that. All right, so the next thing that I'm going to talk to you guys about is this condition that we call trigger finger. So some of you may be waking up and they notice that their fingers are stuck in this flexed position. Or maybe you're doing something during the day and you're grabbing something or pinching something and your finger gets stuck in it. It's almost like you have to use your other hand to kind of manually open your finger. This is something we call trigger finger. So what I want you to do is picture a fishing rod, okay? So the line on the fishing rod is your tendon and it flexes your finger down. And there are rings along the rod that helps to keep the line in place. So we have things in our fingers, the pulleys, that help keep the tendon in place. Now a trigger finger, and you can see in the slide here, there's a nodule that can form, that like pink rounding right there that you can see on the arrow. That forms at the base of the finger. So it makes it difficult for the tendon to kind of glide through the pulley very smoothly. And this is why your finger gets stuck. So kind of like when you're threading a needle, if there's a knot in the thread and you're trying to push it through, you're gonna have a difficult time threading that needle through that hole. This is basically what's going on with your finger, what's going on with your tendon. So like I said before, people complain that they wake up with their fingers stuck, but it can also happen during the day. So what causes this? So it can be caused by an inflammation or repetitive movements, like continuously clicking a mouse. I know I've had some patients who are jewelry makers, if they're kind of in this flex position a lot. So you definitely want to alter your activity and avoid the offending action. So you don't want to continue to have that nodule get aggravated and get stuck underneath that pulley. It's going to make it a little bit more angry. But also it's really important for you to know that trigger finger can also just happen. And there's really no reason why it happened. So in terms of intervention, like I said before, you want to stop what is making it stuck. You want to make sure that it's not getting that stuck position. The best thing possibly to do is either come in and talk to us, and we can either make a splint for you or getting a splint. So I have one here that I made. It's like this little ring. So I'm going to place it on my finger. And basically, it won't allow me to fully flex that finger. So it's not allowing that nodule to get stuck. So it's allowing you to kind of be a little bit more functional, but still kind of giving you a cue of, I can't let that finger go all the way down to get stuck so that it can kind of rest. Your therapist can also give you some like massage techniques, some stretches. Other modalities can also help to reduce the inflammation and improve kind of the range of motion of your digits as well. So Phaeleau, I have been working out a lot at home since the gyms are all closed, and I've been doing lots of like burpees or like push-ups or just like a lot of things on my wrist. And I've noticed that I started having pain like on like the pinky side of my wrist. What do you think that that could be? I'm sure some people may be having the same.
It's a great question, Elaine, because I feel no one's going to the gyms now, and a lot of people are working out from home.
Yeah.
And so they're doing these online kind of workout classes. And I find that this is a very common condition. So when people have pain and you ask them, when did you start the pain? And they said, well, exactly what you just said. I just started doing a lot of burpees. I just started to do a lot of push-ups. I just started to do handstands, or the clean and jerk kind of workout at home where you're getting a lot of pressure on this part and you have pain. And a lot of it, that's what we want to talk about. You have pain here. So if you have pain in this area and you can push in and kind of palpate around there. And if you have pain when you're weight bearing and what we would call supinating, which is this. So when you kind of open up a door or twist and you have pain in this area here, it could be something that your injury is called a TFCC. Now I'm just going to pop to a slide here. And so you can see it's on the pinky side and right around the wrist here. So if you palpate in this area, you'll see this triangular fibrocartilage complex. I know that's a mouthful. So TFCC. So it's basically a kind of complex of connective tissue that stabilizes your wrist. So if you're doing a lot of these weight bearing, or sometimes people who have fallen, a common injury when you fall is to break your wrist, but another common injury is to kind of tear this TFCC. Now, part of the TFCC has much less blood flow than the other. So depending on what part of it, it can be a very slow healing kind of injury. We are used to, in PT and OT, people coming in and saying, hey, I sprained my wrist or I sprained my ankle. Usually there's some structure that was damaged, and depending on the amount of blood flow to that area, it can be a slower or a faster healer. So with the TFCC, it can be a slow healer. So things that you can do for it. So first, you kind of want to make sure that you have it. So this slide here is something called a wrist widget. So you can get this, again, I have no affiliation with Amazon, but that's one place you can get it. There are other places you can get it. And what it does is it provides external support for your wrist. So you'll still be able to bend your wrist, but it kind of acts as, say, an exoskeleton, if you will, if we want to use like Marvel Comics analogy, to stabilize your wrist while the inside of the wrist heals. All right. So there's also some exercises you can do to kind of help it as well. And I'm going to go over those as well. So when you think about the wrist, sometimes I equate it to the, people say, I want to do core exercises to kind of help with my whole core. So I want to work this side, that side, this side, that side. The same thing, you can do that with your wrist. And I see some questions about wrist injuries or wrist fractures, and you can use some of these same exercises. So I have some things that you might have at home or might not. So everyday items that you can use to kind of stabilize your wrist. Now, you can use an exercise like this, and I think everyone's seen it, where you're just kind of going up and down. And if you don't have a weight, if you have a TheraBand, you can use a TheraBand doing the same thing. And again, you want to go all the way around, strengthening the whole kind of wrist column, if you will. But because the pain is on this side, you really want to concentrate and strengthen this area. So you have a long muscle belly and a tendon that crosses right across the TFCC. So you really want to kind of stabilize that. So again, with TheraBand, I'm kind of putting one on my shoulder here, and then I'm making a fist. And then from this view, I'm keeping wrist in a neutral position. And then you're just kind of strengthening there. So I'm working this side here, all right? And I like kind of holding that. So you can do an isometric hold, 5-10 seconds, and then slowly come back. And you can get more tension and then slowly come back. So you're really trying to work this, what we would call ulnar column here. Another thing you can do if you don't have a TheraBand is using an everyday hammer. So with the hammer, you can kind of, I'm just going to pull it back to make sure you guys can see this. Here we go. So I'm kind of going up and down, up and down. So I'm putting it behind me, so it's pointing backwards, and then I'm firing this area here. And again, same thing, you can be holding it up and then slowly lowering it. If that's too hard, you can choke up a little bit. So you can choke up here and going up and down, up and down. Another thing you can do is, as you get stronger, you can try to do some kind of balance or proprioceptive and stabilization exercises. So if you have a kettlebell at home, you can use that, but it would have to be a small kettlebell. So what I've come up with is a thing of detergent. So I filled this halfway with water. So you can fill it with sand or dirt if it gets too easy, or fill it more with water. And then what you do is you kind of hold it above your head here, or I'm using a bent elbow. And again, excuse me guys, I'm just gonna position so you can see it. All right. And then you can hold it up here, and then I'm just kind of moving it back and forth, this way, this way. What I'm doing is all the muscles around my wrist are having to work together to stabilize. So you can kind of shake it like this way. And again, if it's too easy or too hard, you can take more liquid in, more liquid out or put something heavier in it. You can also hold it all the way overhead and do the same thing. So this is kind of, these have nice handles and you can do all kinds of exercises with it. So it's kind of like a homemade kettlebell. All right, so we kind of went over some stuff quickly, and I think we're going to go back to Elaine now, all right, and just kind of sum everything up, summarize everything.
Awesome. All right, everybody. So these were all just a very brief overview of some of the most common hand and wrist injuries that some of you could be experiencing. We do want to reference that scheduling a time to come into the office or scheduling a telehealth visit would be the most beneficial, just because the wrist and the hand are very complex complex areas of our body. And we want to make sure that we do a thorough, a very comprehensive assessment for you. So also some of the splints that we showed you today are great, but having a custom one, it would be the best option. You guys are going to be wearing it all day long, or you're going to be wearing it while you're sleeping. So you want one that's going to be most comfortable for you. And when you come into the office, it's physically fit to your hand and wrist, and you'll be going home with it. Hey.
This is Kai, my assistant.
Hey,
I had to
Kai.
give him a shout out.
Do you think Kai needs any hand therapy?
He has some paw issues.
Oh no. I should bring Romeo into here. But if you guys have any questions at all, please feel free to reach out to our hand team. Phaeleau, myself, our whole hand team, we have great relationships with some of the best hand doctors in the city, and we'd be happy to give you a recommendation. You can also reach out to us at our email. Our email is hand@spearcenter.com for more information about our webinar, or if you'd like to come in and see us or hang out with us. So let's bring back Joe for some Q&A. I'm sure you guys have some questions for us.
Great job, team. That was a lot of great pearls in there, and we are getting flooded with questions here, so we'll try to get to as many as we can. One of the first ones is, Phaeleau, some of the exercises that you showed, are those, can those be used for anyone showing symptoms with carpal tunnel as well?
So the main thing with carpal tunnel you have to be careful with is if you're using your flexors a lot, that can further cause some inflammation. So if you're gripping, or even things like carrying big Trader Joe's bags home, which is sustained grip, so you're gripping for a long time, that can inflame the tunnel a little more, and I try to avoid it. I would say wear a backpack, but you know, I'm kind of ad-libbing here, but an exercise you might want to do is the opposite of flexion is extension. So I'm kind of working my extensors. So I'm trying to work my extensors. With carpal tunnel, I would do more shoulder exercises, trying to strengthen proximally. Again, trying not to avoid trying to use your flexors too much.
Awesome, thank you. A lot of questions about sets and reps and how often should these exercises be performed?
I would say, what's your magic? Are you a magic number 3 by 10, Phaeleau?
That's a great question. So if it's a stretch, I think you should do stretching. Just like if you have a tight hamstring, you should be stretching it every day, holding it 30 to 60 seconds. But if it's an exercise, I do 3 times 10.
Yep.
My kind of gauge is if you're taking a weight and you're doing it, it's like a 1 or 2 pound weight, and you're able to do 3 times 15 and not even feeling it, then I feel it's time to go on to the next weight. So sometimes I'll start off 2 times 8 and then go to 2 times 10 and then 3 times 10. But usually if you're at that 3 times 15 rep and you're not even feeling challenged at all, so you should be able to rest a minute at least in between reps. So you do 10 and you have to rest, you know, so you're really feeling it. So that's my general guideline on that. That's a good question.
Next one is, you both mentioned the vertical mouse. How about using a wrist rest for the computer on the keyboard, as well as the tracking ball mouse?
I feel like both could be options. I think it would depend on what your injury is. So when Phaeleau had referenced the vertical mouse, you know, he was saying that, you know, we're constantly doing this motion. So if you can kind of get away without doing this motion with your wrist with a trackball, that's totally fine too. But again, I think it depends on what injury you have. Like, what is it that it's aggravating for you?
Yes, and if the wrist rest keeps your wrist in this position as opposed to this position, it's more ergonomically correct. So if you're using the wrist rest to get pressure off here and improve your ergonomic position, I think that is good, yes.
Great. Does trigger finger only happen in the index finger, or can it happen in any of the fingers?
It can happen in any of your fingers. I mean, it's very common for it to be like in the middle and ring, but some people can get trigger thumb. I know Phaeleau was telling me the other day that he was getting some trigger thumb. It could happen in multiple fingers at the same time. It could happen in both hands. Yeah, so that's a custom splint that Phaeleau has over there to kind of prevent him from doing that, but it can happen in any of your fingers.
We're also receiving a lot of questions about arthritis, and I know you guys didn't touch on this specifically, but any general things that or advice that you can give for wrist hand arthritis?
Yes, so the thing about arthritis is it's anything with an itis is an inflammatory condition, but arthritis, people usually like heat as opposed to ice. But the main thing with arthritis, or one of the main things, is you don't want to aggravate it. And I don't know if you guys have noticed, like the good grips, like the carrot peelers, they're much larger grips. So in general, something that's a very small grip is going to, say you have thumb arthritis. If you're gripping a lot, you want something with a larger grip. So you really want to try to change your habits. You might have to get some kind of Black & Decker jar openers, because that's a big complaint. I have pain when I open jars. And the arthritis, unfortunately, is not going to go away, but we can kind of help manage the symptoms by alternating your lifestyle a little bit. But arthritis does respond well to some light strengthening without kind of inflaming the joint. Light strengthening to the wrist or thumb can help. And also some stabilization splints, especially for the thumb, can help.
So you demonstrated a couple of tests to see if they were causing any of the pain. If that wasn't specifically causing the pain, but they're having pain kind of in where the picture was showing on the slide, what do you recommend?
Are we talking about that Quervain slide?
Yeah.
That's a little hard to tell. I mean, I would probably recommend coming in for an assessment or coming in for a telehealth assessment, just because, like Phaeleau and I were kind of talking about in the beginning, pain on this side is very different from this side. Pain can be on this side, can be very different from this side, and they might not even be related. So coming in, setting up a telehealth appointment, having us really kind of identify and give you an assessment of what's really going on, we can kind of give you a better option of, do we need to splint versus do we need to strengthen? What do you think, Phaeleau?
Yeah, I mean, that's a really good question, because a lot of injuries are repetitive stress injuries. So it's something of a tendon, and we can do a muscle test. So if you have a tendonitis, if say you have tendonitis in your thumb, if I'm resisting it, you might have pain. If you have arthritis in there, you might not have pain with that. But if I palpate in there or push the two bones together, kind of a grinding test, that's going to be very painful. So there's a lot of tests, and we want to kind of cover 4 very general but common conditions, but there are so many more conditions out there. And if you do have questions, I think it's best to go to a professional and kind of get a proper evaluation.
I'm going to bring this question up because Phaeleau, you used to say it when I was in the clinic with you all the time. Can you discuss a little bit about BlackBerry thumb or texting thumb?
All right, I guess I got to answer this one. So many people are on their phones constantly, and that is a perfect example of a repetitive stress injury. Sorry about the sirens, guys. So I'm just going to let the sirens pass. Can you hear me, or should I keep going?
Yeah, we can hear.
All right, so
we can hear you. Yeah.
You can hear me. So, that's a very common condition. And one thing to do is stop texting for a week and just use your microphone. And if the pain goes away, that's kind of a positive diagnosis of what's causing your pain. Because you see people walking across, I see people, they are on their phones constantly. So yes, you can definitely get an injury. So it's just from the constant texting, and the phones nowadays are huge. They're like flat screen TVs, some of the phones, they're so big. So you're constantly holding this large phone and typing on it. So that can definitely cause an injury, yes.
Excellent. A lot of questions. I know this is a hand and wrist webinar. However, Elaine, maybe you can touch on this. There's a lot of questions about some overuse injuries at the elbow, golfers, tennis elbow, even pain from gardening, things like that. Some comments that you recommend?
Yeah, those are definitely things that we see as well. A lot of them is caused by repetitive stress, kind of like the overlying theme of what we've been doing today. So you want to stop kind of what is aggravating it. So tennis players, golf players, if that's what's aggravating you, I know you don't want to hear this, but you should probably take a break from tennis or golf. We can help you with some stretches. So really stretching out those tendons on your extensors or flexors, or a lot of people have a lot of tightness in their extensors up here. So taking a lacrosse ball and foam rolling over here, doing some manual massage, those can all also help as well.
Also, because that's a very common injury, there is a taping procedure or a taping that we can do from here to here that, so tennis elbow is basically your extensors, the origin is here and it's kind of coming here. So I'm wearing these two braces, and this is the tennis elbow brace. And what it does, it's called a counterforce brace, because what it does is it puts the origin of the extensors here, giving you a break here, because a lot of times you'll have pain here. So if you put the pressure here, it alleviates it here. So I usually recommend people wear this with activity, but then at night they can wear a wrist brace, because for the same reason, because if you're sleeping like this, you're stretching here all night. So you want to kind of rest, and the position is different. When you have the wrist brace on, you want it a little bit extended, so all your extensors are kind of on slack. So this muscle's on slack. So I usually recommend for tennis elbow a wrist brace at night, and then this counterforce brace during the day, and then therapy, taping, etc., and a lot of proximal strengthening. So say you're getting it from tennis, we have to look at your shoulder. You might have limited internal rotation, or you might have weak rotator cuff. And so you're overusing, you might be overusing, and I mean, again, and then we should go to a full eval for that. But for tennis elbow, there's some studies out there that they help tennis elbow just with proximal strengthening and alone. They didn't really even touch the elbow.
Yeah.
So the shoulder is a big part of tennis elbow syndrome or lateral epicondylitis.
What about numbness and tingling in the pinky side of the hand?
So that is, so on this side of your hand, you're innervated by your ulnar nerve. So your nerves kind of go from your brain into your spine, and then go through a bundle of nerves called your brachial plexus, and then travel down through your arm in different pathways. So somewhere where it's most commonly impinged, that ulnar nerve is right at your cubital tunnel, which is by your elbow. So sometimes if the ulnar nerve is being compressed in this side, it can send some numbness and tingling down towards your pinky or your ring finger. I know for me, I get this all the time. Throughout the night, I sleep on my side, I sleep like this, I wake up with a dead arm, or my arm is numb. So one thing that I've told some of my patients, or I've actually tried, is like, there's splints that can help keep your arm extended. Phaeleau actually taught me to like wrap a towel around my arm, so when I flex, I'm not constantly in a full flex position. Nerve glides are also a really helpful thing to kind of decrease the numbness and tingling. Do you have that towel, Phaeleau?
I just happen to have a towel here. So you just have to wrap an ACE bandage around here, and then you can move a little bit, but it's preventing you from doing this, because that ulnar nerve kind of comes around here. So if you're on the phone a lot or sleeping like this, those are common kind of complaints with ulnar nerve symptoms.
Yeah,
So prolonged bent elbow position you have to avoid.
Yeah, I find a lot that like if I'm like laying in bed or like on my phone, I'm like this and I'm constantly flexed by my elbow. I do get like some numbness and tingling too. So it's really all about, you gotta move. We shouldn't be doing these repetitive movements. Gotta make sure that we're stretching. That will definitely help.
Awesome.
It's another phone problem, right? From being on the phone too much.
Yeah, there's a lot of questions in here about phone and texting and using it so frequently. A lot of people are also asking about wrist and hand braces and what should they do if they're having pain even with the brace on?
May
If
not
you're
have-
having pain, I don't think you should be using the brace. And again, if you're having some kind of issues, again, I think you should go to the doctor. And again, you said it in the beginning, Joe, but if you're having pain with any of these exercises or any of the brace, so the brace or any of the exercises should not cause your pain or cause you pain, and really listen to your body. So we're recommending stuff, but if any of this stuff hurts, stop. We want to get you better. We don't want to cause you pain.
Yeah, I would also recommend it. I know a lot of my patients will come in, months later after an injury, and they're like, yeah, I just wore a brace for 4 months and didn't do anything. And now, because they've been immobilized for so long, they're so stiff. So sometimes wearing a brace or a splint is not the most appropriate answer, or maybe some people are getting the wrong braces. So it really is important to consult a hand therapist or a doctor before you think about getting an appropriate splint for yourself.
Another question is, are we closing the tunnel when we are resting our head on our wrist despite it being in a neutral position?
I wouldn't.
So like a compression?
You're right. That's fine.
And for people who want to do push-ups, I would recommend doing them in this position because it's a kind of a compression, but you might cause some more inflammation in here if you're gripping really tightly, or if you're using one of those push-up plus bars where you're gripping, or a large dumbbell. So you can hold a large dumbbell, but in general, the neutral wrist position for weight bearing is better. So the tunnel remains in an open position if it's in neutral.
Couple of questions on the TFCC healing. When you say it takes a longer time for it to heal, how long is that? Days, weeks, months?
So sometimes I make the analogy with, if you take 10 dinner plates and break them, they're all going to shatter in different pieces and different, kind of parts. So that's like with fractures or tears. Some tears are very small, some tears are very large. So it depends on the size of the tear, if there is a tear, but it also depends on the location. So the kind of the inner part or medial part of the TFCC has less blood flow than the outer part. So depends on the location and the size for healing. But a lot of times a soft tissue injury can take up to 3 months to heal.
Mhm.
Awesome. Icing versus heat, if you don't mind, I know you mentioned it for carpal tunnel, if you don't mind just going through for each different condition that you guys talked about, what you guys recommend.
I would probably say, so for Quervain's, it's an inflammation, so kind of like what Phaeleau was saying, so you definitely want to ice in that sense. I know so for some hand patients, a lot of them also get stiffness too. So some people are like, well, I don't like ice, I like heat, but typically for Quervain's, we do recommend ice. For trigger finger, you can ice as well, but some people do have some tightness in their flexor tendon here, which causes some pain while we're extending their fingers when we're trying to stretch that finger. So sometimes heat does help with that, just for us to help stretch those joints in that finger. So it's kind of different for both. And then for what you were saying, Phaeleau, for TFCC or for carpal tunnel, what would you say for heat and ice? I kind of use like a combination sometimes for both for them.
No, exactly. So a lot of times if you're coming in for therapy for trigger finger, you're going to get heat in the beginning to loosen everything up. And I make the analogy like if you're running or playing tennis, you warm up first to get the blood flow going, and then you ice afterwards. So that you're going to kind of do something like that during your session with your PT or your OT. So if you go in to see Elaine, she's going to warm it up. She's going to stretch out all your flexors and do soft tissue, and then she'll apply ice. And I kind of ran to the fridge, and this is kind of like something you get ketchup or mayo in. And I just filled it full of ice. And then I have like a little ice cup machine here. So this is kind of a handy thing. You can take a Dixie cup and then you can kind of do ice cup to your lateral epicondylitis, your trigger finger, your carpal tunnel, and then you can just throw it back in the fridge. So I found these are handy items because then they close. You can put a container of them and have some at work or some at home, or if you work from home, just keep it in there. So we use both. And I like, it's harder, I think, to heat up, and it's 91 degrees outside soon. So in this weather, I'm probably leaning towards doing more ice or inflammation. And again, anything that's an itis, lateral epicondylitis, is going to be inflammation. So I like icing.
Can you guys discuss what if someone has pain in their thenar eminence?
So your thenar is this like meaty part of your thumb. So you can have pain in that part of your thumb for a lot of reasons. Some people could be overuse. Some people can get like a lot of tightness in here. So sometimes we have to do some like foam rolling in here. I know at the office and some of the other hand therapists, there's like a little cat ball that we give to our patients, exactly that. And you can kind of roll it on that thenar eminence to it's kind of like a foam roll for this like muscle right here. You could be getting it from overuse, so like texting or typing or mousing, you can also be having pain in that thenar eminence. Because you're having tightness in that muscle, maybe like stiffness in the joints as well.
Great. And if you can just review again, how is Quervain's diagnosed?
So there are 2 tests that you could do. So that Finkelstein's test that I was showing you, so bringing your thumb into your palm, then wrapping your fingers, and then doing this like hammering motion. So kind of bringing your wrist down towards your pinky. There's also another test called like the what test. This is a newer test where you flex your wrist forward and you bring your thumb back towards you and you resist it. And people will also have pain here as well. But just letting you guys know too, like doing the Finkelstein test and doing this, it's not a comfortable stretch for anybody. So if you're kind of doing it and you're like, oh, I kind of think something, it could be tendonitis, it couldn't, but true Quervain's, people, it will be like a super sharp pain that you want to stop immediately.
Any common things where there's pain on the backside of the wrist?
So you can have, these are where the carpal bones are. So and again, it depends on the mechanism of injury. Like say I fell really hard and now it hurts here. The first thing I'm going to think is bone. So, and again, I think therapists think bone, ligament, tendon, nerve. And the way you describe the pain, dull, achy, deep, I might think bone. Kind of zingy, zappy, I'm thinking nerve. But you also have something kind of called cysts back here a lot. So you could have a fluid-filled sac there, or dorsal ganglion cyst is a very common kind of condition that you can get on the back, the dorsum of your hand. And again, pain with weight bearing, stuff like that. So it could be that. So it could be any number of things. But first thing I think of is cyst or fracture or tendonitis. You can have extensor tendonitis, and that would be kind of a resistive test.
Awesome. Okay, great. We have a ton of questions. I don't think we're going to be able to get to all of them. However, we will try to follow up with everyone individually with any questions that they may have. We hope today's talk was valuable and that you learned a few ways to prevent and perhaps manage some symptoms of hand, wrist pain, and injuries. Like I said before, we will do our best to reach out directly afterwards to address any questions. The hand and wrist is a very complex area of the body, so it's always great to get an individualized assessment. In addition to that, we are also going to be sending out a handout of all of the exercises that were discussed today so that you can reference them. And we're going to put up a slide of our contact info right now. And as an orthopedic outpatient practice, we treat an array of conditions from head to toe. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any one of us individually. And we will personally help coordinate you being set up with one of our team members for an evaluation. We are located throughout the city. We have 20 locations. And in addition to that, we also have Spear Live, in which we can do telehealth. So we're here for you. We want to thank you guys all very much for spending some time with us today. We hope you enjoyed our webinar. Be well, and thank you very much.